Everyone, how are you? Welcome to another video lecture on physiology of MRCS. A patient with tachycardia and hypotension is receive vasopressor. Which of the following conditions are most likely to be treated with this vasopressor? So the vasopressor agent which is used, which of the following type of the shock? Here the options are the hypovolemic shock, septic shock, neurogenic shock, cardiogenic shock, and none of the above. So we have to find out one type of shock in which vasopressor is used, and in this shock tachycardia develop and hypotension develop. Tachycardia and hypotension develop. First of all, let's see the septic shock. In septic shock, what happens? First of all, the bacterial infection occurs, and after this endotoxin and other microbial product are produced. Binds of exotoxin or binds of lipopolysaccharide with protein in the serum, binding CD14 receptor on the mononuclear cells, and finally release of the chemical mediators. And these chemical mediators, it acts on the vessel and causes relaxation of the vessel and increase the vessel diameter, and peripheral pooling of the blood occurs in the blood vessels. What is the management of the septic shock? First of all, to large bore IV cannula or IV channel open, then normal saline bolus dose 1 to 2 liter in the wide open given, then supplement oxygen and empirical antibiotic should be given, and in additional here the vasopressor which may be dopamine, may be noradrenaline, may be adrenaline, may be used. It is the vasopressor. So the vasopressor, it is used for management of the septic shock. Vasopressor, it is used for management of the septic shock. So septic shock, the vasopressor is used. Here is the another figure here showing the source of infection. Any source of infection, it may be lungs, it may be urinary tract, may be nose and paranasal sinuses, and other area it may be bone infection. The bacteria enters into the blood, and when bacteria enters the blood, it causes release of the different type of the chemical mediators, and which acts on the blood vessel and causes leaking of the blood vessel, and leaking of the blood vessel leads to the blood in the spaces, different extracellular spaces, and finally the organ dysfunction occur and death occur. So the septic shock or septicemia is one of the most dangerous condition in shock type. So here we can see this is the septic shock. In septic shock, vasopressor is used, and other option here such as the hypovolemic shock. In hypovolemic shock, there is volume loss, so there should be given fluid. Here fluid given. Here no role of the vasopressor. Neurogenic and cardiogenic shock. In cardiogenic shock, there is pathology in the heart, so the pathology of the heart should treated. Here the vasopressor usually no effect, and neurogenic shock also, here the vasopressor usually not very much active. So the septic shock is the answer. In septic shock we use vasopressor.